We are live on YouTube now. So, e-surgery, Mohammed Kahna, you can start now.
Okay, thank you.
You got 3 minutes. When you are ready, just let me know.
Yes. Okay.
And everyone, please,
Can
if
you
you
see my
listen this,
screen?
yeah, I can see your screen. When you see this noise, so e-surgery, Mohammed Kahna, you can start now.
Okay, thank you.
Are you ready? We got
Yes.
3 minutes. When you are ready, just let me know.
Let's go.
And everyone, please, if you listen this, from whose PC I am hearing this voice. Please unmute yourself.
Okay, there is a sound or is okay.
And please unmute yourself, everyone. Please unmute. Are you ready?
Yes.
3 minutes. When you are ready, just let me know.
Let's be.
And everyone,
Okay.
please, if you listen.
Welcome to our startup entitled e-surgery. It's okay to enter the world of surgical innovation in Africa. As a surgical technologist or health professional in the operating room, I see that many hospitals in Africa.
Hello? Kindly increase your audio because we can't hear the volume. And then you speak slowly, so that we can hear everything. Yes. Go
Okay.
ahead.
Welcome to our startup entitled e-surgery. It's okay to enter the world of surgical innovation in Africa. As a surgical technologist, a health professional in the operating room, I see that many hospitals in Africa have the same problem. The operating theater still causes anxiety and apprehension in many patients. According to World Health Organization, 75% can lead to a refusal of care, difficult working conditions. This is appear necessary to implement a method of conditioning and relaxation of patients, operating under local anesthesia to optimize the care and working conditions. So our objective is using technology in the operating room. That is what mean is surgery, digital surgery. It, we have an intelligent smart operating table use the artificial intelligence technique of music therapy and mixed reality between augmented and virtual reality. This is aimed to help patients operated under local anesthesia to relax, restore vital signs, and reduce anxiety, stress, and pain. And this decrease the percentage of operating complications. So, let's take a look on our products and service. First, an intelligent operating table. This is operating table start talking by itself using intelligent artificial with the patient during his surgery. Our technique is the music therapy. That means using musical extract to therapeutic purpose. So our robotic operating table has application mobile to collect data, artificial intelligence to speak with the patient, and mixed reality to connect it with music therapy to relax the patient. Our partner, I have two partners from America, Peace First, and the organization of global surgery under name One Surgery from United Kingdom. Our project is based on scientific study. I published my scientific article in Acta Scientific Neurology after using our product. So, the name of my article is scientific is the contribution of a music therapy in the operating room to see the effect of music therapy on the psychology of the patient undergo surgery. So, I can, with the spread of COVID-19, we continue working to improve the physical and psychology state of patient infected with COVID-19. Especially this is the result of our project. We going to optimizing the care, improving mood and patient satisfaction, physical and psychological supervision, and of course eliminate the risk of contamination. So the advantage of our project for the patient, physical and psychology monitoring, helping to treat faster, improving mood and patient satisfaction. For the health professional, eliminate the risk of contamination, saving the time, optimize support, collect data remotely. So finally, this is my information contact. I am Mohammed Kehna, surgical technologist, this is an entrepreneur in digital health. That's all. I finished. Thank you so much.
Thank you very much for your presentation, Mohammed. A very quick question. Could you please tell me? I have two questions actually. First, what is it that you make? Have you made a platform for AI content, music content, and AR plus VR content for the patients, or are you also creating the content or producing music or AR products for the treatment? That was my first question.
Okay, our startup started working in three last months, only in Tunisia, in many operating room in different hospitals in Tunisia. And with the spread of COVID-19, we continue to working to improve the physical and psychological state of a patient and doing a scientific study to know more about the problem and especially the efficacy of our solution by collect data remotely, talking with the patient infected with COVID-19 through an intelligence artificial and asking questions remotely. And this is aimed to eliminate risk of contamination for the health professional and its opportunity to contribute the digital tools in operating room. There is another.
Mohammed.
Hi.
Yeah. Okay. Let's say you're just doing pitching. Kindly tell me in like in 1 minute, what solution is your technology bringing on board? What gap have you realized?
Okay, this I want to after this is presentation, I will send you in message a link of my article, scientific article. He has all the information about the technology and the data. So.
Okay.
Okay. Our team is composed of 3 members. We are all surgical technology in the same surgical team in Tunisia Hospital. We work with the smallest table toward our objective to grow up our startup and increase the development of a surgery in all the countries of Africa, in all hospital in each country in Africa, not only in Tunisia.
Allow me to ask you once again. Is this technology present? Is it a prototype, or what stage is it in?
Oh, prototype. Oh, this is my prototype. Okay, come.
Oh, okay.
Okay, this is. You can see this.
Mm-hmm.
Okay.
So that is the product you're intending to sell, Mohammed. Is that correct?
Okay, my operating table. We put the screen in the head of operating table. This screen has application worked with the music therapy, and it's cheap technique. We don't have a lot of money to create an application or to create and trade on artificial. I start my startup just with only $1,500. And when we sell our service to a clinic or to other hospital, each service they give us an old operating table, and we give some modification to be a smart operating table, and this service will be $1 million each service. Its modification.
Mohammed, I think there is your computer doesn't have enough voice, because I can't hear clearly.
Okay.
Okay. Wow.
I have some video to know our experience in with my passion. Okay.
Okay. Yeah. Sure. So that we understand.
Oh.
Okay.
This is a patient with a music therapy for relaxation. Okay. And this is an application.
So you are promoting and so what you're creating and selling the application. Is that correct?
Yes.
Yes. Very good. Thank you. Sorry, Violet.
So it is a mobile application that you are selling.
Application has under name Surgical Music.
Okay.
An application composed of many musical extracts from the National Association of Music Therapy and the University of Tunis Al-Manal, and when the patient placed on the operating table, he put the headset on his ear, and they listen to music for relaxation and to be more satisfied. This is our experience, and I put all this information in an article, in scientific article. This is all, and thank you.
Thank you very much, Mohammed. Banu, you're muted.
Reggie Muteva, 102.
Yeah.
103. Sorry.
Yes. Can you see me?
Yes, we can see you, Reggie.
Should I share my screen?
Yeah, you can start sharing your screen. When you are ready, let me know.
Okay, my screen is shared.
Yeah, and now your time starts now.
Thank you. Good afternoon. My name is Reggie Mutetwa, and I'm the CEO and founder of Wellness Script Solutions. I am presenting for our company today on employee wellness and health training for African companies. So the problem we were solving is that employees and companies in Africa, they lack access to wellness and preventative health training. This is on one hand. On the other hand, we have got independent wellness service providers who lack a distribution platform to sell their wellness services to companies and employees. And this is against a background from work that we have done in companies. You will find that between 30 and 53% of employees suffer from lifestyle diseases like hypertension and diabetes, also mental health issues. So the company, the employee, and service providers all are all affected by this problem. So our solution is an employee wellness and health training marketplace. So I've illustrated here. In the middle, that's us Wellness Script, our wellness training platform, which is online. And we've got the sellers who are the content creators, and also the service providers who are health service providers. And then our buyers are employers who buy for the consumption of their employees. And this is a business to business transaction. So what materials do we have? We have got physical, mental, and financial well-being training modules that are put on our platform. And also we use freelance service providers to do workplace wellness checks. Like if an employee will do our courses, we then use the profiles that we capture to refer for one-to-one virtual consultations with mental health practitioners and health practitioners. We split 60% to the seller and 40% revenue split to us when we collect revenue. Just to put more light on it, so in the middle, that's the training wellness program. And the moment an employee joins, they also join a wellness social network within our application where they get extra encouragement and participation from other employees. And then record keeping and also wellness prizes for achieving employees to incentivize uptake of wellness behaviors and also the courses. I've already touched on workplace wellness checks and also collection of lab samples from the workplace for onward testing at the labs and the referrals. So if we look at the marketplace, and we are targeting to get 15% of the total addressable market, and this comes to 13 million employees in Africa. So our traction, we have got a minimum viable product that is available. Just to say, we started face-to-face work
time is up. Ready?
Okay, thank you.
Yeah, then jury can ask you questions, please.
That's fine.
Thank you very much, Reggie. Could you please tell me a little bit about how far you've come? So I see here 7 companies have signed up. Are they all service providers, or are they all potential recipients of the services on your website? And please elaborate on your payment model and how are your company making money here?
Okay. So the 7 companies that are signed up are actually consumers. These are companies that have signed up for their employees to take the modules. Mm-hmm. And we are working with, like at the moment, because we are seeding the marketplace, we have got 4 independent content creators that we are working with, who have been already training face-to-face wellness trainings with companies. So at the moment, we've got 3 modules. 1 on breast cancer, cervical cancer, and prostate cancer, and we are recording the other modules. The companies that we've signed up come up to about 1,200 employees, and this was like in a period of 2-week marketing, because we are only 1 month with the digital platform now, when we launched the digital platform. If I should give a simple example, when we were doing the face-to-face activity, we trained a mine on breast cancer, cervical cancer, and then we also actually collected vaginal swab specimens from the mine and tested this in the lab for human papillomavirus, which is the #1 risk factor for cervical cancer, and referred with the results referred to doctors for further service. I think on that one we did like $6,500 receipt of revenue. You also asked about how do we share the revenue. So for content creation, which is very straightforward, we do 60% we give to the content creator, and we retain 40% of the revenue. If the content creator doesn't have video equipment, because we've invested in our own video equipment, we then shoot the video ourselves. And if we are shooting the video and helping the content creator, we take 60% of the revenue, and the content creator takes 40%. I don't know if that answers your question. If I didn't leave something else.
You know, I'm still having a little bit of a hard time explaining who is paying.
Sorry, yes, I left that one out. So what we sell to companies. So a company decides that they want to have their employees access on a particular module by module basis at the moment. So when a company decides, we basically say, if you've got up to 100 employees or less, that's $100. If you've got up to 300 employees, that's 150, for example, and then 250 for people who are employees above 500. The price can also be adjusted depending on the module and the person giving the module, but that's how we charge the company. And once a company pays that amount, all their employees have access. And what we then now, our learning module gives reports to the company to say which employees have done, we have signed up, we have not finished, and the companies can also incentivize. We have got a wellness dollar incentive. So the company can fund a wellness dollar for employees accrue points and they check out as dollars. So it's also a bit customized to how far the company wants to adapt the system. But it's all automated. So we've actually been giving reports to the participating companies.
Okay. Okay, Reggie, so kindly tell me more about your team.
Okay, thank you. So this is our team. Myself, my background is biomedical sciences and biomedical research, working in the community, working at hospital level and clinic level. And I have MSc in epidemiology. I'm the CEO. And then I've got our Bettina Chikojo, who is a BSc e-commerce. So she does our digital marketing. And then we've got our technical officer, chief technical officer, which is Emmanuel Takawengwa. He's got BSc computer sciences. So he's the one who basically does custom code for platform. Our advisors, we've got Prof. David Katzenstein, who is a retired professor from University of Stanford. And then Ms. Nyamakura, who is a nursing science lecturer at the University of Zimbabwe. She also happens to be one of our content creators that we are working with.
So I wanted to ask, is this a new concept, or it's an addition to an already existing initiative? Are you the only one? Are you the only organization doing it?
So you find we have got a number of companies and startups doing area-specific digital provision of health services. But in terms of training health employees on wellness and health, at the moment, we are almost like the only ones who actually have created a platform targeting wellness training and health training to change behaviors on employees. So you find for companies, they already were having like financial wellness people. So they'll bring in a financial wellness person face to face, and they will, this person will give a talk to the employees. But no one is actually built a multi-sectorial platform where companies just go and they access different courses. In addition, the way we incentivize uptake, because the biggest challenge with current wellness programs at companies, there's no way to check the impact. So with our system now, companies can actually see if employees are participating and if they incentivize, what's the impact, and we can follow longitudinally to see actually, for example, in terms of diabetes and hypertension, we can follow longitudinally to see what's the impact on diabetes and hypertension control or on employee mental health issues. So that's our unique position.
More questions, Yuri?
No more questions from me. Thank you very much, Reggie.
Thank you very much.
No questions from me.
Thank you for having me.
Yeah, then we go to next 104.
You're welcome.
Eman Wahabi.
Stop share.
Yes, hi, this is Muaz Hussam. I'm here for Iman. Just gonna share my screen.
Okay.
Okay, can everybody see my screen and hear me clearly?
Yeah.
Yes.
Okay, great. So, here we go. All right. So hi, my name is Muaz Hussam. I am the co-founder and chief product officer of Rology. At Rology, we are working in solving one of the main problems facing the medical sector in Africa right now, which is the shortage and misutilization of radiologists, which in turn causes a high latency in reporting time. Now, if anybody is unfamiliar with radiology or diagnostic imaging, let's just say that a radiologist report is a very, very important part of the diagnosis of the patient. And without an accurate radiologist report or even any radiologist report, a cure and treatment for the patient will be very challenging to achieve. This is one of the problems facing all of Africa. And if we look at some of the numbers really quickly, we would see that, for example, in Kenya, there is only one radiologist for each 215,000 citizens. In Nigeria, it's only one for 600,000. Ethiopia is only one for each million. And Ghana is only one for each 842,000. So this is a very serious problem. Our solution to the problem is an AI-assisted teleradiology platform that can remotely and instantly match between radiologists and cases coming from different hospitals based on the availability and the subspecialization of the radiologist. And we also help radiologists increase their reporting productivity through an AI-enabled DICOM viewer. Now, this is not just a solution for one country, this is a solution for all of Africa. We offer a very unique value propositions for hospitals and radiologists who work with us. Hospitals get a fast and accurate reporting service. They get to lower their cost, and they get coverage for all subspecialties. There are 8 different subspecialties under radiology, and hospitals working with us can get 24 hours, 7 days a week coverage of all 8 different subspecialties, something that is very hard for any hospital to achieve. And they get a zero setup cost. Radiologists get some flexibility. They can work from any time at anywhere. They get to increase their income and their capacity, and they don't have to worry about working with different administrative teams from different hospitals. The product works in 3 main steps: upload, where the hospital will upload the patient scans along with the medical data; match, where our platform would match it with the optimum radiologist based on the subspecialty and availability of the radiologist; reporting, where the radiologist receives the scan, use the platform tools to study the scan and write the report that then will go to our internal quality assurance team, and then finally will be delivered to the hospital to deliver to the patient. Now, we offer everybody who works with us a fast, accurate, and on-demand service. Hospitals who work with us get an on-demand service. They can use us when they need us, and they can forget about us when they don't need us, whether it's 1 case a day or 100. We also offer zero setup cost. Hospitals working with us don't have to worry about expensive hardware, servers to be set up at the premises of the hospital. All that is needed is a PC and a normal internet connection, and they are ready to go. We've been in market for 3 years now. So far, we have worked with 84 hospitals, and we have helped saving more than 100,000 patients. We work in 5 countries: in Egypt, in the Maldives, in the DRC, in Kenya, and in Saudi Arabia. Our guiding principle is the third SDG. We believe by offering higher quality medical quality service, we are helping achieving the third SDG goal. And really quickly, 2 impact points to illustrate how helpful teleradiology can be. Since the start of the COVID-19 situation, we have worked on developing an AI model that can detect COVID-19 in chest CT scans. So far, this model has actually been more accurate than a human radiologist. And while a human radiologist might need a few minutes to come up with a report,
your time is up.
Okay, thank you. A few seconds.
Okay. Muaz, thank you for your presentation. Kindly share with regard to your revenue.
Can I share what?
Revenue. Like how much did you sell it to the hospitals? Yeah, so that we can know how you're generating revenue.
Okay, so we
the possibility of scale up.
Okay, we generate revenue from the report itself. So we sell the medical service. We do not sell the technology. So the hospital pays for each medical report that we deliver to them. This is how we generate our revenue.
Or you sell the service, okay.
Mm-hmm.
So like now, if you're given the money, like the $1 million, what are you going to do with it?
Okay, so we will be using it to expand into more countries and focus more on more African markets we are targeting. We're targeting the African and the Middle East markets, and we will be expanding our operation, reaching out to more hospitals, increasing our team, and so on. So if you guys give us $1 million, it will be in turn helping us increase our service to more and more hospitals and save more lives.
That's enough from me.
Thank you very much. I have a quick question as well, or two questions maybe. Could you please explain what challenges you are currently facing in expanding and scaling up? Do you have is it the business development part where you need to work, or is it are you having regulatory issues with international relations in terms of certain countries having certain laws and regulations about who can be considered a professional and deliver such reports to the hospitals and so forth? Could you say something about the challenges?
Sure. So it's a challenge, but it's not an impossibility, because when you target a new market, you have to, especially when you work in healthcare, you have to study the legal situation and work with it. But right now, like I said, we work in 5 countries, and we have managed to be in compliance with the laws in all of them. It just takes some planning, but I wouldn't say it's a stopper for us. The business development part is a challenge right now, especially with the situation as traveling is very restricted and hard to many parts. So we have to rely on a remote model of service, which is not the ideal situation to have for a healthcare solution. So I would say this are the 2 main challenges we are facing right now. But hopefully, as the situation with the COVID-19 gets better and things go back to whatever would be the new normal, we'll be going back to normal.
Perfect. Thank you very much for your presentation.
Thank you.
Yeah, so I saw in your presentation you stated that you are being utilized by 84 hospitals, isn't it?
Yes.
All right. So when did you start?
October 2017.
Oh, October 2017.
17, yeah, so 3 years.
Okay. So like expanding to other countries, has it been quick, or what challenges did you encounter in scaling up?
The biggest challenge when entering a new market, especially with healthcare, is first to gain a very good understanding of the legal situation there. This is the first step we would take. We need to know how to provide our service in a legal compliant way, how to handle the patient data in a way that complies with the regulations of the country. This is the main challenge. Other than that, it's just, the process for closing a deal with a hospital or healthcare, it tends to take around 3 to 4 months in general. So I wouldn't say it's a challenge, it's just the nature of the industry.
Okay. Kindly share more about your team.
Okay. So right now there's 26 of us. We are 4 co-founders. We have about 9 persons in the technical teams, 4 sales team, and 5 in the medical team. Just to make sure the medical team are not the team that's doing the reporting for the radiologists. The radiologists work with us in on-demand model. They are freelancers in a way. Our board member is comprised of these 4 members: Dr. Khalid Ismail, Mr. Shigo Rohanda, Dr. Amra Abdullah, and Mr. Khalid Al-Sharbatli. They cover they have experience working in the Middle East, in Asia, in Africa, technical experience and business experience.
Okay, thank you.
You're welcome.
Please stop sharing your screen. Then we go to next. Number 105, Girls Care Africa, Ribeiro. Is it correct? From Rwanda? Ribeiro, are you here?
Yes, I'm here.
Yeah. Sorry, good afternoon. I'm going to represent the team of the bureau.
Let me check.
Can you hear me?
Yeah, your name is Dennis, right?
Yeah, my name is Denise, but I'm part of the bureau team.
Okay. Yeah, you're not issue.
Okay, let me share the screen.
Yeah. Let me know when you are ready. I will start your stopwatch.
Okay, I'm ready now.
Okay, your time starts now.
So good afternoon. Okay, good afternoon. We are Girls Care Africa, and we are made of three people: Margaret, Francois, and also me. So, despite the efforts that Rwanda put in promoting menstrual hygiene management, the sanitary pads are still expensive. Not every girl or woman can afford the full sanitary pads package, and there is no possibility to buy the pieces of pads that they can afford. So we came up with a solution, which is a girls' care vending machine. And with this machine, girls and women get affordable sanitary pads everywhere, anytime, and safely. So our product is actually eco-friendly and easy to use. Anyone, anywhere can use it, and also it keeps sanitary pads safely. It's cost efficient, and no matter the amount of money you have, you can get your pad. And also, it occupies a small place. And another thing is that any kind of pad, it will have it. So like any pad from any company. So why is this important? So the lack of affordable sanitary pads expose girls and women to different challenges. So according to the Sustainable Health Enterprise, 18% of girls and women missed out on school and work because they could not afford to buy sanitary pads. And also sometimes when girls are not getting their pads, they could ask their money from people can sometimes abuse them or stigmatize them. And another thing that I didn't maybe put here, but also sometimes girls can find a way to to sort this problem out and use some materials that could lead to different infections. So it's really a problem that needs a natural solution. So this is how this vending machine works. So the girl will need to have a local coin, and then we enter the coin in the entry point, and then after she will need to press the button that corresponds to the specific type of pads that she needs, and then the pad will automatically come out. So we want to promote menstrual hygiene management and provide comfortable access to them. And our potential market is that we use our vending machine will be installed in the girls' bathroom in different places where many people meet, like bus stations, school, marketplaces. And also, we want to partner with the sanitary pads manufacturing companies, yeah, in Rwanda and out of Rwanda. So we need the financial support. The production of this office and also the market expand for the African countries. So
Your time is up.
Thank you very much for your presentation, Denise. You fell out a little bit because of the connection. But I think I got the most of what you presented. Quick question. There's no. I completely agree with the problem at hand, and that it needs to be affordable sanitation. Could you please sanitary pads? I mean, could you please explain how your product will make or provide a more affordable sanitary pads? Is it through
so,
the companies or yes?
yeah, actually, where the problem is that the sanitary pads cannot be sold as one piece. Like for example,
I
if you want to buy a sanitary pad, you need to buy like the whole package. There is no chance of buying like one piece of pad in case you need it. So you need to like buy the whole package. So we want to make sure that girls and women are not facing those financial hardship buying the whole package, yet they buy one by one as they need it. Yeah. So
I understand. Perfect. Also, I see that you showed a photo of one. Have you made a prototype, or have you produced any of these?
yeah, we haven't yet made a prototype. We are currently designing, but we already designed how the vending machine will look like.
Yeah.
Like for example, the buttons, how it should look like. Yeah, we designed that.
Very good. And is it? Are you planning to have it produced locally?
We actually connected with another. I can say that it's a school that actually works on other vending machines. So we connected with them just to ask like the raw materials needed, and if it's something that can be actually produced locally, it's possible if they get all materials needed. So it can be done as a prototype. Otherwise, we also connected with another supplier from Pakistan, I think, and India, and they also told us that it's really something that can be possible. And yeah, if we have like the money to do that.
Thank you very much.
I have a question. Why would someone decide to go and purchase at your vending machine and not go to the shop? Why should they select you?
Okay, so the reason why they can select us is because first of all, we sell those sanitary pads at comfortable places, so they won't feel even in our society there's still misinterpretation of the periods. Like sometimes people think that when you're menstruating, you're dirty. So it will just eliminate those problems of feeling like you don't have to go like somewhere to buy it, but you can get it anytime at that comfortable place. And another thing is that if you don't have like that, for example, 1,000 of buying the whole package, the two of them, the two pieces that you need maybe at that moment, and then you can buy the other one tomorrow as after getting the other money. So it's quick, it's fast. You know, for example, when students at school also sometimes they need to buy those pads. So when she doesn't have that sanitary pad with her at school, she has to make sure that she buys that sanitary pad out of school. So if there is that vending machine in their bathroom, then it would be very easy for them. They will get it anytime. Yeah.
Okay. Another question that I have is this idea unique, or you saw it somewhere and you're trying to replicate it in your country? Yeah, so I just wanted to know, is it already in existence?
Okay, so this vending machine is in existence, but not in Africa. So we've never read about it in Africa. It's something that have been tried off in other continents, but not in Africa. So we felt like it can work in our context. Yeah, based on different problems that we meet. Yeah.
Do you foresee competition when entering the market, especially from the other ones who are using a different business model?
Okay, so
how are you planning to tackle it?
Okay, so the competition, I won't say that it's a competition, maybe another company working on that vending machine. We don't have that one. We don't see that in our country, or maybe in other West African countries. But then we can see a challenge of maybe working with the sanitary pads manufacturing companies, because we wanted, for us, our wish is to work with all of them, because if a girl maybe likes you to use the best ladies type of pad, or maybe the super type of pad, we want her to find that specific pad in our vending machine. So
Okay.
if the company maybe one company refused to work with us, then we won't be able to satisfy the needs of our girls. But
Okay. Kindly share more about your team, yeah, so that we can get to know the expertise.
Okay, so my team is made of so we are a team of three. By now we are a team of three, and Margaret is the nurse by profession, but she has been advocating for healthcare. And also we have Francois Levero, he's also an IT by profession, and I'm also a sexual reproductive health advocate, and I've been working on the project for girls. Yeah.
Okay.
Do we have questions? Judy?
Thank you very much, Denise.
Okay, then we go to next, pitch number 106.
Just a minute. Yeah, so Denise.
Yeah.
So with so in your team, who's going to be in charge of the vending machines? Because I'm not seeing someone who's going to be like has expertise in procurement or yeah.
Okay. We have even though we don't have that one, we have a Francois Ribeiro. He's an IT.
Yes, I'm here.
But we also we haven't yet expanded our team, but it's something that we have in the process, and and it's also something that can be possible through trainings. Yeah, we believe that it can be possible based on our experience.
I'm seeing Francine wants to answer.
Okay.
I'm seeing French. I don't know how to pronounce it. Francis.
France.
Yes,
Hello?
you're saying something. Yes, we can hear you.
Okay, thank you. I'm Francois Ribeiro from Team Africa. I want to add something for what Denise said and respond to a question that concerns about who is in charge of vending machines. Of course, I'm in charge of vending machines because our vending machines, we are going to provide and more competent with other vending machine according to one of the main point that our vending machine will be using renewable energy from solar energy, and we are trending to provide vending machine that are very, very helpful to girls from the rural areas, not only for urban areas. Yeah, that's something I want to add. Thank you.
Thanks. Kihumuro, you're trying to say something.
Oh yes, I'm coming in next. So I'm waiting for Mr. Bani. Go ahead.
Oh, okay. Mr. Banu, you're on mute.
Okay, yeah, sorry. Yes, I'm trying to disturb you as less as possible from my side. Yes, next 106 from Uganda. Health Shore International. Kihumuro Wilbur John, are you here?
Yes, I'm present. I'm here.
Yeah, please start sharing your screen.
Okay.
And let me know when you are ready. I will start the watch.
Can you see it?
Yeah, we can see it.
Okay, that's good. Okay, I'm beginning now.
Okay.
Thank you. My name is Dr. Kihumuro Wilbur, founder and CEO of Health International Limited. Now, allow me to take you back to the year 29 when a problem occurred to me. One evening, I'm walking down the street going to the market, and a speeding car comes out of nowhere and knocks me. A few hours later, I'm semi-conscious lying in a local health center, drenched in blood, and my thighs are all bleeding. Good enough, the doctor that was there was able to arrest the bleeding. So he suggested that I get a blood transfusion, but unfortunately, the blood they had at that time had gone bad due to poor storage. They had not had electricity for some time. So he then suggested that I'm referred to another facility. And that's where I was actually transfused. And that's how my life was saved. So experience goes ahead to show us that severe bleeding accounts for greater than 35% of pre-hospital deaths and nearly 40% of the deaths within the first 24 hours due to lack of information on where to find facilities with blood. On the same note, at least 5 million blood units are wasted every year due to poor blood cold chain systems. So the problem that we solve at HealthShare is we do not only reduce health wastage, but we also help people trace and know facilities that do have blood. So we do this with the help of our AI technology. We have AI technology that helps us turn solar sunlight into refrigeration. And we do have an AI-powered mobile application. So what the refrigeration technology does, we have this AI technology that is able to convert sunlight into refrigeration energy that then enables us to transport blood and store it at the health facilities. So our business model is very easy. The general public subscribes to our AI app, and we charge a small delivery fee on delivering our vital medical supplies. We also rent out our powered refrigerators, solar powered refrigerators. As we speak right now, we make 100,000 commercial deliveries per year, and we are working with close to 1,000 hospitals within 4 countries, African countries. We have so far saved close to 1.2 million lives. We're very aware of our competitors, and unlike our competitors, not only do we safely transport blood for the need, but we also store blood at the facilities to prepare for the need. And we also, using our AI-powered mobile application, we help provide information to the doctors in case they want to refer people. They should be certain that where they're referring the patient, there's blood, or the general public. Let me say, in case you have like, your wife is pregnant, or you have a sick sister, or she's bleeding, you need to take her somewhere where there's blood, our AI app comes in. Our team is very robust. As I've told you, I'm a medical doctor with 10 years experience in medical logistics and medicine. We have marketing, we have solar engineers, and our future plans are to reach 150 million lives by the year 2027. We are seeking funding for $3 million to help scale to other countries and develop our technology. Thank you.
Thanks, Kihumuro, for your presentation. Yeah, but they are giving out $1 million. You're asking for 3 million. Yeah. Anyway, yeah, I'd like to know, like, when did you start?
We started in the beginning of 2018, March. So that's when we began. We began by delivering medicines, vaccines, and we later ventured into blood transportation. We noticed that Africa has a problem with the poor blood cold chain systems. I mean, blood gets wasted. So we decided to venture into that. And lack of timely access to blood, that's a major problem as well. So we decided to dive in there and see how we could be of help to the African continent.
Okay. So as you had mentioned in the slide prior, you're not the only ones who are doing this. So
Yes.
you guys are not the only ones doing this.
Yes, as I said, we are aware of our competitors, but unlike them, they simply deliver blood. Just take an instance, it's midnight. And who are you going to call to take blood to a very remote health center? But unlike our technology, we have solar-powered refrigerators that we actually give rent to the health facilities that cannot afford, or we sell them to them. So blood is actually prepared, is actually available when needed. We prepare for that need, that urgent need for the blood. So you don't, medical people don't have to fidget, trying to call here and there, trying to look for blood and save a life.
Okay.
Yes.
So your target market, you mentioned it is?
Our target market.
Your target market.
Yes, as you know, blood, everyone needs blood.
Yeah.
Be it a man, be it a woman, be it a child, we all need blood.
Okay.
We are all prone to accidents. You know, it's just like it happened to me, it can happen to anyone. So I would say our target market is everybody, you know, and hospitals that actually carry out transfusions, and NGOs that actually have interests in healthcare.
Okay.
We can partner with them and actually reach the people, all these remote centers.
Okay. The reason why I was asking who's your target market is, you know, when you're saying it is everyone, that means that since you said we're using AI, that means that even me as an individual, I can just type and I can you bring the blood to me. So that's why I wanted to know whether it is the institutions like the hospitals where that is the point of contact, or that's why I wanted to get
Okay, to know. Okay, now as I said earlier, our AI app is open to the general public. I mentioned when I said that in case you have, let me say, a husband who has a mother who is bleeding, or rather a wife who's bleeding, or you have a child who has just had an accident, you need something. You need to, our app can help you locate a facility that needs blood, because I believe you can tell, anyone can know that someone has actually overbled, you know? And you wouldn't want to go to a certain hospital and they tell you they don't have blood, or it is spoiled and you have to move. And those are the 35% people I was talking about earlier in the problem that die before they actually reach the hospitals, the 35 pre-hospital deaths. And the nearly 40% deaths that occur within the first 24 hours due to lack of information and facilities on where the blood is.
Okay. Like I'd like to ask about scalability. Like have you implemented it in just the district you are based in Uganda, or you are now in all of Uganda?
We're actually all over Uganda.
Okay.
We're all over Uganda, and given our national health system, when you look at it, we have regional referral hospitals, we have health center 4s, we have health center 3s, and I know all those people have people who and actually carry out transfusions, you know?
Okay.
And I'm sorry, let me get your question again.
No, I think you've answered.
Okay, but we actually outside Uganda as well. We're scaling outside, and we do this. What we do, we partner with organizations, let me say like Red Cross. They actually help us scale to other places, because we alone can actually, it becomes harder. And that's one of our challenges that has actually slowed us down.
Revenue.
Sorry?
Like, have you mentioned anywhere regarding revenue, how much you have generated?
Yes,
so
we
far?
have, as I said, we make an average of 100,000 commercial deliveries.
All right.
So, every delivery we charge between $8 to $15, 10. So that's an average of about 10. So in a year we make about $800 US dollars.
Per person?
$800,000.
Or 800,000? Okay, great.
No. That's per year. That's annual income that we make.
Annual profit
No, that's gross.
$800,000.
or
Yes,
annual turnover?
800,000. Yes, gross.
Okay.
Mm.
Okay.
I'm sorry you couldn't see my face. My camera is having some issues.
No problem.
Pardon me for that.
Sorry, just 2 quick questions from me. Can you explain if I might not have seen if you did? Could you please explain the delivery drivers? Is it how's your setup? Are they employees of you, or are they contracted, or?
Oh yes. Now to do with the logistics, these are our employees and these are our motorcycles. I'm actually showing you a motorcycle up here. I don't know whether you can see it.
Yeah, no, I saw the
So-
motorcycle, but I wasn't sure if you had sort of like a Uber model, or if you had your own employees drive it around.
We do use our own employees because, let me say, if you were to use Uber, you don't know how fast they're going to reach you or how fast they're going to reach the destination. Because that blood, we're dealing with things that are actually on demand.
Yeah.
So it's really urgent. So we're not yet, but we shall look into it with time when we maybe include other medical essential supplies that are not so urgent like blood.
Yeah,
the time
I'm not necessarily saying it's a good idea. That's why I was asking.
blood is asked for, it is needed at that time. So we have, I hope I've answered that
Absolutely.
question.
Yes, and so, but you briefly also mentioned your annual turnover, but can you answer, is your company currently profitable? Are you currently making money doing this? Yeah.
Yes, we're realizing some profits. Some profits actually come and trying to trickle in right now, because we are able to cover operational fees and pay our staff. So, but we haven't really gotten where we want to, because that's why we're looking for funding. I mean.
Yep.
Mm.
Very good. Thank you. That's all the questions I had.
You're welcome.
Thank you very much.
Thank you. Mm.
Yeah, thank you. Please stop sharing your screen. Now we go to next one.
Okay.
Mercuse.
Is it off? Okay.
What did we say? Yeah, it's stopped.
My screen is off. Okay.
Yeah,
fine.
yeah.
Thank you. Mm.
Next, number 95, Mercuse. Zunia Tube from Ethiopia. Are you here? Okay, then we go jump to next 96, Last Mile Medicine, Martin Kieng from Kenya. Yeah, Martin. I see you here, Martin. Are you on your screen?
Yes, yes, I am.
Yeah, perfect. Yeah, you can start sharing your screen now, and when you are ready, just let me know.
You able to see my screen? Sorry.
Yes.
Yes, we can see your screen.
Okay. You can start. My name is Martin Kieng from Last Mile Medicine, in which we are connecting the fragmented pharmaceutical supply chain by redistributing surplus, unused, unopened, unexpired medicine to the uninsured and uninsured low-income patients. Through this, we see ourselves in restoring health and reducing medical waste. Looking at the health finance situation, I'll zoom in to Kenya. There's close to 1.5 million people are pushed below the poverty line threshold annually. 3 out of 4 Kenyans are at risk of falling below the poverty line because of direct out of payment. This is not a problem only in Kenya, and it's in Africa. It's at the moment it's being devastated by health and economic shocks of COVID situation. Just to cite an example, James Okoth, who is 52 years old with 4 children, 3 in primary school, one in Form 1. He was diagnosed with cancer in 2018. Initially didn't have a national health insurance cover. He has 20 chemo sessions to be covered to finish all the from the ailment that he's suffering on cancer of the breast. He spends close to $15,000 per month. This is close to $1,150 a month just on medicine. This will go for the next 12 months. He will spend close to $21,600 in the next 12 years. When all these are happening, in Kenya alone, 46% of healthcare facilities have no records whatsoever or processes in place in the disposal of expired or unusable drugs. And in all this, from World Health Organization statistics, 1 in 4 health deaths among adults, women, are caused by non-communicable diseases. These are heart disease, cancer, diabetes. These are people who live by the drug and survive by the drugs. So how we work is repurposing medicine from the pharmaceutical supply chain, be it from the manufacturer who have the API, who own the active drug ingredient, to the distributors, to the wholesalers, to the retail pharmaceutical, and to pharmaceuticals itself. These are the people that we work with. So a patient comes in with a prescription. He gives out to the pharmacist. The pharmacist verified if it's from a certified practitioner. After getting that clarity and confirming, he looks at what is available in the last mile platform. Sorry.
Questions, please.
I have a question for you.
Yes.
So the last mile, what technology are you bringing on the table?
So the technology that we're bringing on the table, ideally, we are working with currently working with blockchain. And more or less, as you know, so that is one technology that we're working with at the moment. Further, we'll look into exploring working with AI-enabled technology. Yeah.
So are you already in existence? Or this is a prototype?
Yeah, currently we're working with the prototype. So we are working closely in Kenya over here. We are working so closely with just a small team from the Ministry of Health, exploring how well the solution will work. So currently at the prototype stage.
Quick question for me as well.
Yes.
Have you investigated whether or not you need certain types of permits to be able to buy and sell this medicine? And also, is there any regulatory issues connected to the purchase and potential sales of expired or near expired medication?
Yeah. So as I mentioned in our approach, the way we were approaching it. So currently we're working in close collaboration with the, so as we know, the drug or anything that concerns drug is highly a regulated sector. So we're working so closely with the Ministry of Health, so that when exploring and moving on with this innovation, we are really we are really not away from what is happening with the pharmaceutical sector itself. So yeah, there's that part where we work with the government, and there's that part that we work with the pharmacists themselves, the suppliers themselves.
Right. So this is clearances that you expect to receive. Should
yeah, this is the clearances that we are yet to receive, because there is not yet well-defined. It's like we are innovating in crisis, where there's no proper adhered regulation that is in existence, and with coming in of COVID, the situation has been put into another level, because the concentration from the board that concentrates on regulating which type of drugs that are being used. Even right now, there's that high risk of people getting drugs that are not that are not to the standards, because the concentration has been pushed towards COVID. So there's this tension between the current crisis and supply and demand that makes this place becomes a little bit of a challenge to have a control on.
Right. Thank you.
So,
yes.
How come I'm not seeing myself? Oh, okay, wait. Yeah, so I have a question for you. Another question is is this a new concept? Like, is it a new idea? Or you've seen it somewhere and you want to try it here?
It's not an innovation that it's non-existent, what I can say, but what we are having, looking at the players in the distribution chain, people are looking into different ways of handling the supply chain. If you look at if we have, for example, MyDawa in Kenya, for example, that is an e-commerce. So ours, it's slightly different, because the target market that we are looking for, the kind of diseases that the kind of patients that we are reaching out to, it's a unique target. So globally, we were still exploring who are the people who are having such kind of a solution. We haven't yet seen, but we are yet to explore more.
So you stated the target market is?
The target market is the uninsured and underinsured low-income communities.
Okay. So is your solution trying to insure them or what?
We are not trying to insure them. These are people, if, for example, these are people who, when I say uninsured, they don't have insurance. Uninsured, these are people who have insurance, but for example, here in Kenya, we have a national health insurance, but at the end of the day, it doesn't cover it just cover you to a certain extent, as opposed to you having a private insurance that will cover you wholly. So you find most of these people, you'll find some will have it, so that's the challenge. So these are the people that we are reaching out to, and then the people, the patients that are suffering from non-communicable disease that are coming from this market segment of uninsured and uninsured. So these are the people that we want to reach out to, but now utilizing the pharmacies that are there. If you can take, for
Okay.
example, during COVID, you have an ailment of diabetes, so it makes you to come into a higher risk if you go to your typical centralized hospital. So why don't we reach out to these people wherever they are, where they are?
Oh,
in
so
close-
so if I get you right, you're saying that if there are extra medicine, unused medicine in hospital,
Yeah.
they can be given now to the uninsured and underinsured.
Yeah, and sometimes because of poor procrastination that happens in the system, I talked of there's that demand supply that you can't that is often unpredictable in the kind of emerging markets that we are in Africa. So so if there is surplus from the manufacturing side, if there is surplus from the distribution wholesalers, this is what we utilize to
Okay.
reach out to patients. Yeah.
And now my question is, do you think it is possible for a hospital, if they have excess, for them to give it out for free, and yet they are saying that they don't have money to purchase drugs? So how sure are you that they are going to give out this unused medicine? How are you going to overcome the challenge of them refusing to give out the unused medicine?
So because what we are aiming for is having a close collaboration with these people straight from the beginning. But now just offering them that one is just as a solution. Could we? So what we are aiming going further, because at their side, they wouldn't just see the sense of us just giving beyond just us utilizing the surplus that they have. They would want to see how does their patient perform, and at some point the patients that they do have that they cannot it's difficult for them to serve them because of maybe economic issues. This is person who maybe defaulted or something. So this is the only way that we could have this cross collaboration where we can find ourselves arguing with, finding ourselves having this conversation with them to enable them reach out to this patient. The human part that we see from your statistics, these are the people that you do have that are in dire need. So will you see them suffer and die the next morning when you have surplus? So that is where we are at. Yeah.
Okay.
Sorry, I didn't do the rest of my slides. So because
because you didn't even you have not shared about your team.
So that's my team. So I have Lois Nduku, who has close to 10 years in developing digital platform. And then she's our chief technical officer. There's James Mwangi, who currently works, who was working with Jacaranda Health. He has an MPH. He has an extensive M&E in health. He has 7 years plus in health. There's Bokayo, who has been in marketing for fast market consumer goods. Talk of Unilever. We have Martin Nagaya, who has been because we are trying to understand the financial health. So he has been working with finance for inclusive development in Uganda and Kenya. Just understanding. Yeah. So that's.
Okay. Can you go back? There's a slide that was there that we hadn't seen. There. Next.
So,
not this one. The other one.
Yeah. In terms of revenue for B2C, we aim at charging a percentage from the drugs bought, because at the end of the day, I remember you asking me for these hospitals that have this in surplus. So how do we utilize that, and how do we create market for it? So we aim at charging it we aim at seeing it. We aim at costing it at an incentivized cost, charging 70% lower than the market price. For B2B2C, we aim at charging a fee to utilize our platform, where we see a partner fully, partner can fully incentivize or partially incentivize the medicine for the medicine. So that's the two parts. So in all this, we work so closely with the pharmacy. So they get a percentage for the connection to the patient, to the available drugs, and also during refill.
And how will you, you know, like in Africa, what has been experienced is that hospitals, they get medicines from now, let's say like KEMSA, but these medicines don't reach the lower levels hospitals because of pilferage. So when, don't you see a situation where these people may be selling to you the unused, and yet maybe it was supposed to be in the system, but they diverted it?
Yeah, so we know that risk is there, and that is what is going on in the system. So that is why we are coming in, systemizing all, coming in and systemizing all the systemizing the healthcare system. So just to cite in an example, just for someone who, just here in Kenya, as in when we were having, during the COVID period, there was this patients, for example, there was a concerted effort to reach out to patients who had diabetes, but there was no existing data. All this data are granulated of patients. Just one example of people suffering from non-communicable disease, to cite out diabetes. All this data is granulated from different health. They have it. You find an NGO, they have it. So if we look for a concerted effort where all this information is just in one place, and if there is surplus, and if these hospitals are given and they're able to be monetized from what you've gotten from the wholesaler and the producer, this we are able to quantify with the amount of drugs that are being taken out. So if you're able to look at the two parts, so that is where we come in and uptake that surplus that they do have. Since we have the data over here, and on the other side, there is, in terms of drug utilization within the institution, is being monetized as well.
Do we have more questions? Judy? No? Okay.
Thank you.
You can stop sharing your screen, and then we go to next participant, number 94.
Yes.
Yeah. Mario, right?
Yes, Maria, yes.
Maria, sorry. Yeah.
Trying.
Yeah. You can start sharing your screen. Let me know when you are ready so that I can start time.
Yes. Can you see my screen?
Yeah, it's coming. Yes, we can see it now. Thank you.
Okay.
You can start now.
Okay. Hello everyone, I'm Maria, and I will speak today about Telesaúde Educativo. So according to the World Health Organization, the problems in Angola are the following ones. The health system is under-resourced. There are more than 50% of the population who does not have access to health services. The out-of-pocket expenditure is just too expensive. There's one health center per 25,000 persons. There was also a severe shortage of nurses, and 70% of doctors are concentrated in the capital. The healthcare consumption is just low. So what is our solution? We have a nurse-led platform that decides to invest in primary care. We provide preventive care, we teach healthy lifestyle choices, and we identify common medical conditions. So we are more focused on into the prevention with demonstration videos in Portuguese. We also care about personalization. We will give the right service at the right patient, and also prediction. When you see that there's something wrong, we will refer them to free telehealth doctors when needed. So our solution is sustainable, affordable, and accessible online and offline, as you can see. What is the market size? Besides Angola, who has approximately 30 million of people, we decide to be present in other African Lusophone countries, such as Guinea-Bissau, Cape Verde, São Tomé and Príncipe, and Mozambique. How does it work? The user has to register themselves. They have to have an account on our platform, and then they will have to make a calculation of the bioindex, of the biomass index. This is all present in our platform. They also have to measure their blood pressure, and all this information has to fill in the personalized form with the questions and then send it back to us. So we will send a personalized response after a while, and we also have a contest. The more videos they will watch and the more right questions they have, the more chance they will make to win. So what do we want? We want to step away from the sick care system that we are in, only focus on curing people when they are sick. And we want to go towards a preventive care where we increase the knowledge of the patient by informing and re-educate him to create healthy behaviors while he is still healthy. We would like to have 125,000 users by 2023 and 1 million by 2030. What are our competitive advantages? We have demonstration videos to inform and re-educate the consumer. We have contests to incentivize the people to watch the videos. We will also collect data about children in Angola who did not have the immunization, and we will educate the mothers about the importance of immunization. We will also improve maternal health care. This is why we work in partnership with the organization Zero Mothers Die. We have a B2B platform. So the platform is free for user, but we have a B2B business. We will advertise for other businesses, and we will also do data exchange with other institutions. So our team consists of myself. I am the founder, and I'm a registered nurse with more than 15 years of experience. I'm also a member of telemedicine and e-health, and of the digital transformation group. Wilson Miala, who is the co-founder, and he is a bachelor in business management, and Di Costa, who is an expert in digital business.
Your time is up, Maria.
Oh, okay.
Maria.
Thank you. Yes?
You are speaking so fast. I think you are doing so because of time element. Yeah. Anyway, let's say that you're just pitching. Kindly tell me, using like 1 minute, what is the problem you're trying to solve?
The problem we try to solve is that people, I'm trying to put my camera on there. The problem we're trying to solve is that people can't afford the emergency care. So the secondary care and the tertiary care, when they go to the hospital, out of expenditure, they can't pay for themselves. So we are trying to reduce this by already making an action when they have non-emergency care, when they only have to manage chronic diseases, or when they are having already a high blood pressure. We are there to re-educate them about their health so that it doesn't go into the emergency factor. For example, when we, because I can't have it.
Andre, are you able to understand? So that maybe I'm not getting it. Kindly elaborate, Andre, what you are getting from this presentation.
No, I think both, Violet. I think I will need to understand a little bit more.
Yeah.
Take us through the beginning again.
Yeah, start again, Maria, but go slowly.
Yes. So
Yeah, go slow and don't speak fast.
okay.
Go slowly, yeah, so that we can get to know what is the problem. If we are
problem
asked, yes.
is that in Lusophone African countries, such as
Yes.
Angola, for example, and Mozambique, Cape Verde, there are not only many health apps, such as in West African. If you see Nigeria, other West African countries, they have many healthcare apps in English. You go to the Francophone African countries, you also can find some health apps in French. But in Lusophone African countries, you can't find health apps to help them in Portuguese. So
Okay.
like, they are left behind. And what we are trying to create now is a health app, a platform that will help them, since they can pay for the care, for the medication and other types of care. We will be there to help them, and they don't have to pay for this. And we will help them in their own language, in Portuguese, because they don't have access to telehealth care.
Okay. So, are you already a provider of free medical care? Is this app supposed to, because I understand it's an app for the Portuguese speaking population.
Yes, it's a platform of nurses, and what we offer is education of the patient, information, health information, so that to
on
reduce
a voluntary basis or on a state-funded basis?
Can you repeat the question?
So the nurses who give the advice in the app, is that on a voluntary basis, or are they being paid by you or by
They are
anyone?
being paid by me, yes.
Yeah, okay. And so how are you generating your revenue, Maria?
I work on the side. I work as a nurse part-time, and that's how I'm.
I understand. So the app will be dependent on contributions from NGOs or from government or some other form of funding.
That's what we are trying to do, to generate funding now. Yes.
Okay.
Right.
No, continue, Andrew. So like this particular competition is seeking to give out $1 million. So what are you going to use that money for?
We will use that to pay the nurses, because right now we have a cardiac nurse, we also have a pediatric nurse, and we also have a midwife and a laboratory technician who are working for me. And we also use to buy medical equipment, because what we want to do, we want to incentivize the people to come and watch the videos, to be educated. And then we will send them medical equipment so that they can measure their blood pressures at home, like this one, or have an oximeter to measure the oxygen of the children who have respiratory disease at home. We will send them this when they win the contest. So that, since they can buy it from themselves, we will offer them this.
Okay, let me ask you, is it operational right now, or it is a prototype?
We are in the beta phase. So we have a limited amount of users now.
Okay. What do you mean? You're in the beta phase. What does that mean?
So we are not accessible for everyone. We have a limited users to see. Also, we want the feedback from the users so we can improve our platform. That's what we want. And then make it available for everyone.
Right. But just a quick question for me as well. So, but the way I understand it, you will continuously be in need of more donations.
No, because, did I say that? No. We will also generate revenue. We will do, because we will also collect many data. So we will do data exchange, and we will also advertise for other business. Angola is an emerging country. There are many businesses who are formed every day. They want to be visible. So if we have a platform with many users, we will advertise for other business, and they will pay us. We will also reference the customers, the users, to other platforms for teleconsultations, and we can generate revenue from this also.
Right, for pay products.
Yes.
I understand. Okay, very good. Yeah, thank you. I was having a hard time understanding that part of your business model, and that makes a lot more sense. Thank you.
Okay, thank you.
Any more questions, Curie?
Quick question for me. What was the name entered for this company in the competition? Because I
Yes.
tried to look at the photo there, but it didn't match up with what I had in the judging.
I think you won't be having this, Andre. She is not from today's list.
Yes.
Okay, okay.
Yeah, we will let you know. She is number 94.
94, yes.
Yeah,
Number
she's
94.
number 94. Maria Pedro from
Yeah.
Angola. Yeah,
Oh, so does that mean that?
Yeah,
But
we will provide.
are we allowed to judge or what?
No. You are allowed to judge. Only thing you can have a scoring in your mind or on your paper. But yeah, we will provide you more information about that. And we have recorded
Okay.
this.
Okay.
If you need this session to see again, we will provide you.
Okay.
Yeah, but you won't find her in today's list because she is from yesterday.
Okay.
Yeah.
Thank you.
And then we have like 95 was missing. Let me call him. Mercuse, number 95, Junia Tube from Ethiopia. Do we have him here? I think no, he didn't show up. Okay, then thank you all the participants for today. You can leave now. And jury can be still here. I need to talk to you.